The virus you breathe without knowing IT. What every adult over 60 needs to understand about hantavirus right now, Hook. Midnight to 3 o'clock. I need you to think about something for a moment. Think about the last time you walked into your garage, or your storage shed, or your basement. Maybe it was last weekend. Maybe it was last month. You went in to grab something you hadn't touched in a while. Holiday decorations, old tools, a box you keep meaning to sort through. You were in there for maybe 5 minutes. You moved a few things around. You noticed a little dust. Maybe a few dark specks in the corner that you barely registered. Maybe some old nesting material tucked behind a shelf. And then you walked out, closed the door, forgot about it entirely. Now I need to ask you something, and I need you to really hear this. What if that 5-minute trip, that completely ordinary, completely unremarkable errand, was the moment you were exposed to one of the most dangerous viruses in North America? No bite, no scratch, no contact with any living animal, no smell, no warning of any kind, just breathing. That is what makes hantavirus different from nearly every other pathogen you have ever been warned about. And that single terrifying fact is exactly why most people who get exposed have absolutely no idea it happened, until weeks later, when they suddenly find themselves fighting for their lives. Here is what makes this even more alarming. You won't feel anything for days, possibly weeks. You'll sleep normally, eat normally, go to appointments, spend time with your family, live your life completely unaware that a virus is replicating inside your body, quietly, systematically, moving toward the moment it announces itself. That window between exposure and consequences, that silent, invisible stretch of time where nothing seems wrong but everything is already in motion, is what I call the quiet window problem. And it is the single most important concept you need to understand about this virus. Because by the time the symptoms arrive, the window for the most effective response is already closing. I'm Dr. Franklin, and today I'm going to give you something the news headlines this week are not giving you. Not panic, not dismissal, but precise, accurate, actionable information. By the time this video ends, you will know exactly what hantavirus is and what it isn't. You will know how it actually enters your body and what it does once it's there. You will understand why adults over 60 face specific risk considerations that most mainstream coverage completely ignores. You will know the quiet window problem in full, and you will know exactly what to do because of it. Stay with me until the end, because the information in the final section of this video, about the specific words you need to say to a doctor if you've had any potential exposure, could be the difference between early intervention and a crisis. Let's begin. What hantavirus actually is? Biology, not headlines, 3 to 8 o'clock. The very first thing I want to do is ground this conversation in biology, not in the alarming language of this week's news cycle. Because the word hantavirus is being used in current coverage as though it refers to a single, specific, new threat. It does not. Hantavirus is a family of viruses. There are more than 40 known species within that family, a number that has grown significantly as genomic sequencing tools have improved, and they have been circulating in rodent populations and occasionally infecting humans for decades. The name comes from the Handan River in South Korea, where scientists in the 1970s identified one of the original strains after studying unusual illness patterns in soldiers stationed near the Korean border. That was over 50 years ago. Here is the critical context that most people watching this week's headlines are missing entirely. This is not a new virus. This is not a novel, emerging pathogen that the scientific community is scrambling to understand. This family of viruses has been studied by epidemiologists and infectious disease specialists for more than half a century. Its transmission routes are documented. Its clinical presentation is well characterized. The genuine scientific uncertainty that makes novel pathogens so catastrophically dangerous is simply not present here. Think back to early 2020. The reason SARS-CoV-2 created the level of global disruption it did was not simply because it was dangerous. It was because nobody knew how it moved. Nobody had baseline immunity. Nobody had a tested treatment framework. The uncertainty itself was the catastrophe. Hantavirus is not in that category. That distinction is not a reason to dismiss it. It is a reason to engage with it intelligently, which is exactly what we are doing right now. Now, if this virus has been around for decades, Why does it keep resurging in news coverage? The honest answer: it never went away. It is, and has always been present in North America, Europe, Asia, and South America. What changes is not the virus. What changes is the level of human activity that brings people into contact with the specific environments where this virus lives. And that is precisely why this particular moment, right now, with people cleaning out properties, opening cabins after winter, clearing storage spaces, is when exposure risk rises. Not because the virus is new, because people are walking into the places it lives. How it actually enters your body, the mechanism nobody explains clearly. 8 to 1400 hours. I am seeing significant confusion about transmission this week, and I want to address it directly because the misunderstanding is creating both unnecessary fear in some people and dangerous complacency in others. Many people assumed immediately that hantavirus spreads the way COVID-19 spread: respiratory transmission, person to person, shared indoor air, being in the same room as someone infected. That assumption is incorrect. And understanding why it's incorrect is essential for accurately assessing your own risk. For virtually all known strains circulating in North America and most of the world, hantavirus is not a human-to-human pathogen. It is a rodent-borne virus. It lives in the bodily excretions of specific rodent species: urine, feces, and saliva. In North America, the primary carrier is the deer mouse. In parts of Europe and Asia, different rodent species carry different strains. Now here is the mechanism that makes this virus so quietly, insidiously dangerous. And this is the part one needs you to truly absorb. Those rodent excretions do not have to be fresh to be a risk. They dry out over time. As they desiccate, they break down into microscopic particles. Particles so small they are invisible to the naked eye, with no distinctive smell, no color, no sensory signal of any kind. And those particles become suspended in the air of whatever enclosed space the rodents have been inhabiting. When a person enters that space and breathes, they inhale those particles. That inhalation is the moment of exposure. Think about the kinds of spaces that create this scenario. A cabin closed up for the winter. A shed that hasn't been opened in months. An attic with old insulation. A storage unit. A barn. A basement. A crawl space. Anywhere that small rodents might find shelter, nest, and leave traces of their presence over weeks or months. You walk in. You start moving things around. Those particles, which settled onto surfaces, onto boxes, onto the floor, get disturbed. They become airborne again. You breathe. You have no idea anything happened. You feel completely fine. You walk out, close the door, and go about the rest of your day. That is the exposure event. Silent, odorless, invisible. No warning system in your body activates because there is nothing to feel, nothing to detect, nothing to trigger concern. And this is exactly what I mean when I say the quiet window problem begins not when symptoms appear, but at the moment of exposure itself. The cleaning protocol. What to do before you enter any high-risk space, 14 to 1730. Before we go any further into the biology, I want to give you the practical cleaning protocol right now because this is immediately actionable and some of you have spaces that need to be addressed. If you need to clean any enclosed space that shows signs of rodent activity, droppings, nesting material, gnaw marks, anything, here is the non-negotiable sequence. Step 1. Before you touch a single thing, open every window and door in that space. Let it ventilate for a minimum of 30 minutes before you enter to work. Fresh airflow dramatically reduces the concentration of airborne particles. Step 2. Put on an N95 rated respirator mask before entering. Not a cloth mask. Not a surgical mask. An N95. The particle size you are dealing with requires that specific filtration rating to block effectively. Also wear rubber or plastic gloves before touching any surface. Step 3. Mix a disinfectant solution, 1 part household bleach to 10 parts water. This is your primary surface treatment. Step 4. Before you move or disturb anything, wet the contaminated areas with that solution. You are neutralizing the virus in place before you risk disturbing and aerosolizing particles. Step 5. Never dry sweep. Never use a standard vacuum cleaner in that space. Both of those actions launch particles directly into the air you are breathing. If vacuuming is necessary, It must be a unit with a HEPA filtration system. Step 6. Double bag all waste material. Remove and dispose of your gloves and mask after leaving the space. Wash your hands thoroughly with soap and water. That protocol, applied correctly and in the right sequence every time, dramatically reduces your exposure risk. It is not complicated, but it must be the correct steps in the correct order. Skipping the ventilation step or substituting a cloth mask are not minor deviations. They are the difference between meaningful protection and none at all. What the virus does inside your body. The two clinical presentations, 1730 to 2230. Now, let's talk about clinical reality. What actually happens inside the human body when hantavirus establishes itself? There are two major disease presentations associated with this virus family. They work through entirely different mechanisms. Understanding both is important for this audience specifically because certain health patterns common in adults over 60 interact with both presentations in ways that the general coverage never addresses. The first presentation is called Hantavirus pulmonary syndrome, HPS. This is the form most relevant to those in North and South America. In its earliest phase, it looks almost indistinguishable from influenza. Fatigue, muscle aches, fever, headache, possible nausea or dizziness. The kind of symptoms most adults reasonably attribute to a seasonal bug and manage at home with rest. Then, typically somewhere between 3 and 7 days after symptoms begin, everything changes. The virus, which has been quietly replicating and spreading through the bloodstream, begins attacking the small blood vessels in the lungs. Fluid starts accumulating in lung tissue. Oxygen levels begin to fall. Breathing becomes labored and then rapidly more difficult. What makes this presentation so treacherous is the speed of deterioration once it begins. A patient who is functional the day before can be in acute respiratory distress within 24 hours. The case fatality rate for hantavirus pulmonary syndrome is approximately 35 to 38%. Let that number register. Roughly 1 in 3 people who develop the full pulmonary syndrome does not survive it. That is not a number I share to alarm you. It is a number I share because it is accurate and because it is why the information in the next section of this video about when and how to seek emergency care matters as much as it does. The second presentation is hemorrhagic fever with renal syndrome, HFRS. This form is more prevalent in Europe and Asia. Here, the virus's primary target is the kidneys rather than the lungs. It causes significant inflammation of kidney tissue, internal bleeding, and in serious cases, acute kidney failure. The fatality rate for HFRS ranges from 1 to 15% depending on the specific strain. Now here is where I need to speak specifically to adults over 60, because this is the nuance that mainstream coverage consistently fails to address. If you have any existing kidney disease, reduced kidney function, or are managing hypertension or diabetes, both of which place chronic low-level stress on kidney tissue, your kidneys are not starting from the same baseline as a healthy 30-year-old's. The margin before function becomes critically compromised is narrower. Not insurmountable, but narrower. Similarly, for the pulmonary syndrome, if you have any history of COPD, reduced lung capacity, sleep apnea, or cardiovascular disease, conditions that are genuinely common in this age group, the speed at which declining oxygen levels become a crisis is different for you than for someone with full baseline lung function. I am not telling you this to generate fear. I am telling you this because it is medically accurate and because it changes one specific, practical thing: the threshold at which you should escalate to emergency care rather than waiting to see how you feel tomorrow. The quiet window problem, the most important thing you will hear today, 2230, 26:00. Now, the quiet window problem in full. Here is what makes hantavirus uniquely, almost disorienting difficult to respond to, and the piece of information that almost no mainstream coverage is providing. The incubation period for hantavirus ranges from 1 week to 8 weeks for most strains. For the Andes virus, the strain connected to the current outbreak under investigation, the documented incubation window is 4 to 42 days, with the majority of cases presenting symptoms in the 2nd to 4th week after exposure. Read that again. 1 week to 8 weeks. That means the gap between the moment of exposure, that unremarkable 5-minute trip to the garage I described at the opening of this video, and the appearance of the very first symptom could be as long as 2 full months. For 56 days, nothing. The person feels completely normal. They sleep. They eat. They exercise. They spend time with grandchildren. They go to doctor's appointments for unrelated issues. The virus is present. It is replicating. Their immune system is responding at a cellular level in ways that will not surface as recognizable symptoms for weeks. And they have absolutely no awareness that any of this is happening. Then symptoms emerge, often suddenly, often already at a stage that looks serious rather than I think I might be coming down with something. And here is the devastating consequence of that long silence. The person who cleaned a storage shed in early March does not connect that activity to the fever and muscle aches that develop in late April. They assume influenza. They manage it at home with rest and fluids. They lose critical hours, sometimes critical days, before anyone understands what is actually happening. This is the quiet window problem. And this is why awareness, the kind of awareness you are building right now by watching this, is more valuable than any reactive response after symptoms appear. Because the intervention that changes outcomes with hantavirus is not a specific antiviral treatment. There is no approved antiviral medication for hantavirus. The intervention is early, informed escalation to emergency care, and accurate communication with a physician when you get there. Here is the exact information you need to give a doctor in an emergency room if you have had any potential rodent exposure in your recent history. Say this: I was in an enclosed space with signs of rodent activity approximately a specific number of weeks ago. I am aware of hantavirus and want to make sure it is being considered in your assessment. That sentence changes the diagnostic process immediately. It puts hantavirus on the clinician's radar early. And early supportive care, oxygen supplementation, fluid management, respiratory monitoring is what shifts outcomes from catastrophic to survivable. The window for that care to be maximally effective is measured in hours, not days. Know the triad. Fever combined with significant muscle aches combined with progressive shortness of breath, developing within the 1 to 8 week window after any potential rodent exposure. That combination is your signal to move. Not to wait and see. Not to assume it is seasonal. To move immediately. Population risk versus your individual risk. Understanding the difference. 26:00, 28:00. I want to address something specifically because I see it being misinterpreted in real time. Health authorities, including the World Health Organization and the CDC, have described the overall population-level risk from hantavirus as low. If you saw that language in this week's coverage and felt reassured by it, I understand why. I also want to explain precisely why that reassurance may not apply to your specific situation. Population-level risk statistics are calculated by averaging exposure likelihood and outcome severity across enormous, diverse populations. They include urban residents, people in high-rise apartments, people in countries with established rodent control infrastructure. When you average all of those people together, yes, the population-level number appears low. Your individual risk is not determined by population averages. It is determined by your specific circumstances. If you spend time in rural or semi-rural areas, a vacation property, a hunting cabin, a family farm, your exposure context is meaningfully different from someone whose entire life takes place in climate-controlled urban buildings. If you work in fields involving older structures, soil, outdoor environments, or agriculture, your occupational exposure is not represented in a general population average. If you are in the process of clearing, renovating, or cleaning any structure that may have been unoccupied for an extended period, that activity specifically and significantly elevates your individual risk in ways that national statistics cannot capture. Low global risk is accurate information. It is not, on its own, a sufficient basis for your personal health decision-making. Immune aging and what you can control, 28:00, 29:30. One final piece that sits beneath every conversation about infectious disease risk in this age group, the reality of immune aging. Your immune system at 65 is not the same as it was at 35. This is a biological reality with very practical implications. The process is called immunosenescence, the gradual shift in immune function that occurs across decades of life. Your immune system's first response speed, Its precision in identifying novel threats, its ability to mount a vigorous defense and then regulate that response back down, all of these functions become somewhat less efficient with age. There are specific things within your control that directly influence immune function in this age group. Sleep is the most underestimated factor. Consistent, quality sleep of 7 or more hours per night is not optional for immune function. It is when your immune system does a significant portion of its surveillance and repair work. Chronic sleep restriction measurably degrades that capacity. Vitamin D status is disproportionately low in adults over 60, particularly those who spend limited time outdoors. Vitamin D deficiency directly impairs immune response speed and quality. A 25-hydroxy vitamin D blood test is simple and inexpensive. Ask your physician about it. Chronic low-grade inflammation, driven by elevated blood sugar, visceral abdominal fat, or a sedentary lifestyle, acts as a constant drain on immune resources. An immune system perpetually managing background inflammation has fewer resources available for acute responses to pathogens. And for anyone managing existing conditions, kidney disease, hypertension, diabetes, COPD, cardiovascular disease, please discuss any changes to your health management approach with your physician directly. Your medical history is genuinely relevant to how you assess and respond to this risk. Complete summary and what to do now, 29:30, 30:00. Let me pull everything together clearly. Hantavirus is a known, studied virus family, not a novel emerging pathogen. It does not spread through ordinary human contact. It spreads through inhaling microscopic particles from the dried excretions of infected rodents in enclosed, unventilated spaces. The exposure is silent, odorless, and completely undetectable in the moment it occurs. The incubation window, 1 to 8 weeks for most strains, is the quiet window problem. It is what makes awareness and preparedness more valuable than any reactive response after symptoms appear. The symptom triad to know and act on: fever, significant muscle aches, and progressive shortness of breath. If those 3 develop within 2 months of any potential rodent exposure, go to an emergency room. Give the physician your specific exposure history. Do not wait. For anyone with access to rural properties, older structures, unoccupied spaces, or occupational environments with rodent exposure risk, assess now. If cleaning is needed, follow the ventilate, mask, wet surfaces, never dry sweep protocol exactly and in the correct sequence. For your immune health baseline, prioritize sleep, address vitamin D status, manage chronic inflammation, and have direct conversations with your physician about how your existing conditions interact with your risk profile. Your body is not powerless here. Your awareness is not passive. The information you now have about the transmission mechanism, the quiet window, the symptom triad, and the exact words to say in an emergency room is the difference between being caught completely off guard and being someone who responds correctly when it matters. Be informed. Stay rational. Take your health seriously, because no one else is going to do that for you. I'll see you in the next one. End card. Comment CTA. Do you have an enclosed space, a shed, a cabin, a basement, a storage unit that hasn't been assessed for rodent activity? Drop your answer in the comments. And tell me, when you first heard hantavirus in the news this week, what was your very first reaction?